Afternoon, everyone, depending on your time zone. My name is Janet Walker. I am a co-director with Eric Bruns of the National Wraparound Initiative, and we are going to be getting started in just 1 minute with our second webinar in this year's series. Just before we get going, a couple of details that will help make everybody's experience of the webinar a little bit smoother. You've probably had a chance to look at these bullet points on the slide. So the ones I want to go over, just to be clear, during the presentation you can send questions to the organizer. So actually everyone that you'll hear talking on the presentation today will be able to see your questions. For the most part, we're going to hold those questions until the end, unless it's something that needs some kind of immediate attention, which we will try to deal with, or if it's something that's very specific to you. But if there are questions that we think are of general interest, we will answer those at the end. No one in the audience is going to be able to talk. We have almost 200 people registered for the webinar, so in order to kind of minimize all the extraneous noise that you get with that, we've muted everybody until the question and answer. You can use your hand raise feature at the end, and we will call on you and unmute you, at which point you can talk and say your question. So, and make sure that you've entered your audio pin, otherwise you won't have any ability for broadcasting. We won't be able to hear you. So if we could get going, it's time to start, and I'm going to begin by introducing our presenters today. I want to start out with, we have Mary Jo Meyers with us, and everybody who's here is fortunate to have the opportunity to hear from Mary Jo, as well as our other presenters, of course. Mary Jo is Deputy Director and a founding manager of Wraparound Milwaukee, which is one of the most successful wraparound programs and system of care sites in the country. Perhaps you've heard of Wraparound Milwaukee.
I'll go to Oregon.
I know. Well, we have Wraparound Oregon here in Oregon. That's why I get confused. I sometimes get a little preoccupied with our local things. But they did recently win a very prestigious award from the Kennedy School of Government at Harvard University for innovations in American government. Mary Jo has been involved with training there at Wraparound Milwaukee since pretty much they got started. She's worked successfully with many enthusiastic people around the country, and she has a lot of wisdom to share. Marlene, Matarese, and Kim Estep are both from the Innovations Institute in Maryland, connected with the University of Maryland. And Marlene is Training and Technical Assistance Director, and Kim is a trainer and coach and is very involved with bringing lots of people up to speed in both in Maryland and in other states, working directly with Wraparound Practice to improve practice. And again, Marlene and Kim both have a lot of experience, both themselves doing wraparound and in training others to do wraparound. So we're very fortunate to have such a high caliber group of presenters today. So I am going to turn the presentation over to them at this point, and we can move on to the next slide.
Janet, that was very kind.
Oh, well, thank you. I'm going to mute myself now, so you guys take it away.
All right. So as you can see, the goal for our webinar is to provide you with information on the how and why of implementing a team-based wraparound model, to give you an overview on the rationale for coaching and training, to talk about some elements of optimal training as well as coaching and supervision, and then to make sure you have some ways to support that implementation. What kind of data are you going to use, and how will that help inform you to do a better job? And then we will also be talking about a practitioner certification model that is being used in Maryland and now elsewhere, and then I'll also give you some information on how to set something up locally, as we did in Wraparound Milwaukee. So the way we have this organized is for me just to start us out with some basics. This is Mary Jo. Then I'm going to turn it over to Marlene and Kim to talk to you about what it really takes in a community to support the implementation of a wraparound team model. And then I will close things out with you to try to bring it all to more of a local level. So one of the things we've learned really early on is that people do not always understand why you would even do a team-based model. So you'll see on the next slide a very, very small guide. Certainly there's more information out there if you're interested, but really having the ability to define the difference between case management and team facilitation. So what I've done for you is just giving you some bullet points on how case management is typically done versus the biggest difference related to team facilitation. And to really get a team off the ground, to really have a program or a system of care embrace the idea of case management versus team facilitation, it's pretty important that people do understand the difference. So for case management, typically what you'll see is that someone is assigned to a family to assess the problems and hopefully the needs. That person arranges and coordinates and monitors and evaluates services based on those identified needs and generally uses a categorical approach, which I'll talk about in a minute. A team facilitator is really guiding a team so that it's not that person necessarily doing all the work, but guiding the team in development, overseeing the process, and tasks of team members that have been gathered. So in a team facilitation model, the child, family, and community are really the center or the nucleus of services and supports, and they are viewed as the most effective people. The child, family, and their support system and community are viewed as the most effective people brought together to be the means of support. There's other differences, but for time's sake, I just wanted to make sure people understand there's definitely a difference between case management and team facilitation. And we'll move on to the categorical approach that case management usually uses and what the disadvantages of that can be. Next slide. Okay, so typically in a categorical approach, you're going...
Wait, excuse me, Mary Jo, I'm sorry. I think this is the point we were going to do our first poll.
Okay.
So we're going to, just to let people who are participating know, we're going to put our first poll there, and we'll give you just a few seconds, Mary Jo. We'll keep talking. You can pick your answer, and then we'll show you and talk about the results in a minute. And we'll be doing this periodically throughout the presentation.
All right. Thanks, Janet. So as I was saying, you want to distinguish between case management and team facilitation. And typically with case management, people are using a categorical approach in which they're assessing problems, looking at services that are available, and arranging services for the family. The concerns about that is that what the family then ends up with reflects what's available, what's been tried, rather than what's really needed. So, for example, if we know about certain services that we can offer through our resources in our community and we feel good about it, we as the person providing those services, if we know about them, if we feel good about it, that's what the family will get. It doesn't necessarily mean that the family will get what they actually need. Also, when you have kids who are involved in a system, so they have been involved in child welfare, probation, behavioral health system, what can often happen to kids in need is that they'll receive a placement rather than what they really need in order to stay with their family. And those are typically those kids that have been in multiple placements already. So the concerns with the categorical approach is that it really does not lend itself to families getting what they really need. So just to make sure we're all on the same page, we'll move to the slide on teams and wraparound. So we're looking at three types of team members: natural, informal, and system. And one of the things I always warn people about is while jargon helps us to define so we can get on the same page, you know, what is natural, what is informal, when we're talking to families, as well as we do with any other thing that we're learning, we want to learn what they are and what it means to be a natural and informal support. But those are certainly not the language we should be using with families. So in terms of getting on the same page, those natural team members are those that are connected to family by relationship. Informal would be connected to family by citizenship, so it may be through something they're involved in their community. And system people are those that are paid to help. What you're hoping for is that the team members are generated through those initial conversations prior to the first team meeting, by really just having a conversation with the family in which you're finding out from them what kinds of things they like to do, who they do them with, what's worked in the past, who's been involved. And those are the people that we're hoping to gather to put in place for that child and family team that we're talking about. So families are really encouraged to invite those people that support them or are close to them to keep us on track. It helps us to move the team conversation from treatment or service orientation, which is what we're used to. Most of us that are paid to help respond by, in our head even if we don't say it out loud, with what are those things that we can provide a family that's treatment-oriented or service-oriented, but rather what we want to do is to hear from the family what would they really need to have their life be going in a better direction. And so those natural supports or informal supports help us to have that conversation rather than a treatment or service orientation.
Okay, so just quickly here are the results of the first poll. I don't know, Mary Jo, if you want to comment on those.
So we're looking at 26% of you are facilitating child and family team meetings, 10% of you are responsible for supervising, 14% trainer coach, so that's really good to know. And then the rest is hidden from me, Janet. I can't see the last percentages.
Oh, well, we've got, that's interesting, 26% who are essentially managing, creating or running a program, and then another 25, another quarter, learning about implementing a team-based model.
Okay, thank you. So moving on in terms of what are some things that are helpful when you're learning to implement. So those of you who are first starting out especially, not only do you need to know the difference, you need to be able to talk about what are the benefits. So we often hear that families don't want to have a team, and largely what we have figured out is that it really hasn't been explained to them very well, nor has it been explained with any enthusiasm. So really knowing what are the benefits of a team approach. And so these are just some of them. There very well could be many more benefits, but what I've outlined is the fact one of the biggest benefit that we hear, and we get many satisfaction surveys around, is the fact that the family is so thankful that everyone is on the same page. So we're all working off of one plan. That there's shared knowledge among the teams, and that there's actually a new way of thinking because we've brought together those natural, informal, and paid supports. There's a better use of resources because you have a team that's sharing multiple resources and everybody brings their strengths and resources to the table. So therefore we have more strengths to build on when we're putting that plan together. So hopefully when we're writing that plan that's supposed to be responsive to a family, what we're finding out is that we have more strengths to build upon by virtue of a team that we've brought together. Shared responsibility and accountability. One of the things that we learned early on is everybody was so fearful of this team thing because who would all be involved and who would know what. And what we've really learned is that we all feel better when we're on the same page and we're actually sharing responsibility. It's not just one professional or one treatment person that's responsible for everything, but actually a whole team that's held accountable. And then lastly, and most importantly, you just have better representation and respect for family culture because you have brought people that are important to them from their family and from their support system to represent their family. Now, what do we find in terms of common misses, which will lead us into the next part of our presentation on how do you actually support the practice. So what we found out in terms of looking at misses on the team approach is that staff who do not know why or how, somebody just thought it was a good idea to use the wraparound approach or was the latest thing, but when staff were actually asked to implement a team approach, they didn't understand how they were doing or why they were doing it. Another common miss is mistaking reluctance for resistance and thinking that no always means no. One of the things we learned from a lot of our family support groups that we were running, or family focus groups that we were running, is that families, were not always trusting their care coordinators right away, or the care coordinator wasn't asking them in a way that actually made them want to tell them who their loved ones were, their support system. So sometimes I think we just mistake reluctance for resistance. Another mistake that's often made is telling families that informal and natural supports are invited so that we can work ourselves out of a job. Well, telling a family that, obviously their number one feeling is, well, then what are you good for? You know, why do we have you here? So just making sure that when we do talk about this team approach with families, that we do explain it in a way that helps the family to feel like this is something they want to embark upon and engage in. Team meetings run inefficiently or ineffectively. Some of the tools that Marlene and Kim will talk about in terms of how we run team meetings, we've learned early on that if the facilitator cannot run a meeting efficiently or effectively, then the process does not work. And so there's actually tools that you can use to make sure that we are running meetings in a way that's helpful to families. Next one is process doesn't lead to a product, and what we mean by that is too many times teams were being held just to talk. So we talk about the latest issue or talk about the latest crisis, but no product was formed, no plan of care was developed. Understanding family and team engagement and not being able to discern between the two. So we really learned a lot about how important it is to engage families, but there's also a skill set that's involved in engaging team members so that they want to come back and continue to participate. And then lastly, I think one of the biggest challenges for the team approach and for wraparound in general is mistaking fidelity to a process as quality care or success for a family. So while we do want to work hard on making sure that we are running teams efficiently and effectively, we also need to make sure that we have processes in place to make sure that families are actually getting what they need in the right way at the right time and in the right way. So with that, I'm going to turn it over to Marlene.
Hello, everyone. So we are going to transition a bit to talk about those necessary support conditions. And for those of you who were on the webinar that happened in March, that was the overview to wraparound with Janet Walker and Eric Bruns, you probably have seen some of these slides in the beginning, because the goal that we really wanted to do was kind of to tie it back to what you would have learned on that webinar. Because when we talk about a team-based planning model and the necessary supports, among those, there are more than are just listed here, but is human resource development and accountability. So we're really talking about making sure that practitioners have the tools, the knowledge, and the skills that they need to do quality practice with families. And if they don't have this, if they don't have the tools that they need, if they don't have coaching, if they don't have the right training, then they're more likely to get to a place to where they're overwhelmed, they don't understand the responsibilities of their position, and it can lead to burnout. I know for any of us who have ever been involved in wraparound, when that happens, there's a higher turnover, and you don't ever want families to have to experience that. So next slide. This slide you may have also seen. I'm not sure if it was in the last presentation, but I know I've seen Eric use this slide. And again, it's really talking about what are the key factors in implementation and implementing the high fidelity wraparound process. And the piece that's in the red circle with the arrows is what we're focusing on today. Because again, it's sort of the flow of implementation, but without the training and the supervision and coaching, the flow actually wouldn't happen as effectively as it should. Because the staff have to have access to enhancing skills, knowledge, and abilities as it relates to high fidelity wraparound. So as we move through this, again, we're just kind of bringing it back to the process and what the necessary implementation requirements are. So next slide. So this is a slide, and this is coming from the research, because we really wanted, and we do this at Innovations, to tie back the training and the coaching and the model we use to research that has shown to be effective when you're trying to implement an innovative practice. And what you're seeing right now actually comes from the work of the National Implementation Research Network, and we have the resource at the end of this training. That this is really talking about the process that someone would need to go through to get to a place to where they're ready to innovate an innovative practice. So starting with orientation and new knowledge. So for those of you who have been involved in wraparound, you know that as you start out, you're getting oriented to your job and you go to a training that's most likely a WRAP 101 training. It's there that you get the basics, you can see an overview of the process, but it's still pretty new. And you don't have a full understanding of what this is supposed to look like, why you're doing it, and how it can be used. And then you get to a place to where it's really that perfunctory and routine use. So in wraparound, you know the elements. You know that you're going to go out and you're going to meet with a family and you're going to try and pull together a child and family team meeting, but you're still not at a place to where you can really understand all the different elements, how they're integrated, and what it really means. And as you move to the next levels, it's where coaching and supervision really are incredibly important, because it's a place to where practitioners have the opportunity to really refine their skills and to integrate some of the knowledge that they've learned. So at this point, they probably, in refinement, they understand the elements of a practice model. You know, they understand that there's a team vision, there's a team mission, there needs to be needs statements, strategies, strengths, but until they get to a place where they've had enough coaching, support, and practice, they might not be ready to fully integrate all of it and see how it's all interconnected. And after a bit of time, they're going to move to a place to where their skills, knowledge, and abilities are really being enhanced. And it's at this place where they not only understand the elements, but they're able to see sort of that integration and the connection between the elements, so that they know that there needs to not just be strengths, but the strengths need to be functional and they need to be applicable in a team process. And that we're not just talking about an overarching need, we're talking about the underlying need that's really going to help that family get to that next place and help them reach their vision and that team mission. And once they're there, and again, this happens through coaching, through supervision, through practice, they can get to a place to where they're actually able to facilitate the coordination of high fidelity and high quality practice and actually can implement an innovative model, which would be wraparound that we're talking about. Oh, so we're going to do a poll here. Sorry about that. So as we move, and I know some of you who are doing the poll right now aren't going to see the next slide, but as you're doing that, I'm going to keep talking about training as this core component in implementation. And when we talk about training, we're really talking about the transfer of knowledge and skills and ability. When I talk about knowledge, it's really, you know, the basics. Do you understand the history of wraparound, the theory of wrap, philosophy, some of the rationales for why you're doing it, what does the practice model actually look like, and the process. So you're kind of getting that overview and really building a knowledge set. As you go through this process, you really need to start practicing so that you can enhance your skills and abilities. So the goal would be in training and coaching to get to a place to where you can really demonstrate these practice elements. And part of demonstrating it means practice and getting feedback. And a lot of that ties into the coaching process as well, to where you have the opportunity to actually see practitioners doing the work they're supposed to be doing and giving feedback on how it could be enhanced. Janet, do we now do the poll?
There they are.
Okay. So what folks, the question was, what has been the biggest barrier in workforce development and wraparound for your community? So 17% said fiscal constraints, 49% said varying interpretations of wraparound being implemented. That's very interesting. 12% said workforce turnover, and 22% said the ability to provide training but not ongoing coaching. And this is actually very interesting, and I think that it actually shows what I think is going on nationally. Is from the work that we've been doing, we've been able to see that the way your answers just turned up has actually been what we're seeing across the country, that there are varying interpretations of how wraparound is being implemented, and that without the coaching piece, it's a real struggle to implement a high fidelity model and really do quality practice with families. Okay, next slide. So these are just some of the components of effective training, and again, we're talking about this, we're talking about sort of that partnership between training and coaching, and that both are really critical in building a workforce that has the skills that they need to do their job. Training that's effective is often delivered through lecture and discussion because you're really trying to build knowledge and understanding of the content. You know, in this place, you're talking about perhaps the values or the different elements of wraparound. but you also have to move to that next place where you're giving an opportunity to build skill sets. And I think sometimes, I know I've been involved in wraparound training at different places to where there's a focus on those values and the different elements, but you never get an opportunity to really practice and to build your skills. And that's really critical in order to do your job effectively, because you need to understand how you operationalize that. Because after you leave the training, you go out and do it, and if you're not able to practice it, it's too new and it's too scary, and it actually can lead to care coordinators to get pretty stressed out. Training combined with coaching creates the conditions in which quality implementation happens. So again, it's really that partnership between the two, because folks need to learn, but then they also need to practice, get feedback, refine, and continue to go through the process so that they can enhance their skill set. Next slide. And this slide's focusing more on just the components of effective coaching. That coaching really needs to be based on the practice model, be readily available, and reflective. So again, that coaching really needs to be something that you're doing side by side with someone, able to see them do the practice, walk them through the different elements of the work that they're doing with the family, and provide feedback during that. One of the things that we'll talk about later is in the model that we use at Innovations is really walking through each step of the process, so each of the phases that a care coordinator would be going through in their work with families, to really walk through in coaching, to go through, okay, you're picking up the phone and you're calling a family for the first time. So what are you going to do? Let's practice that, because there's a skill involved in that, and that's the first time you're going to have an opportunity to engage a family. And I think a lot of times when we look at training, some of that's left out. So you can really dig in deeper once you get to a coaching process and walk through, okay, you're going to do your first crisis plan. Okay, now you're at your first team meeting. And really walk through and practice all the way through transition and be with them each step of the way so that they can build skills that can transfer and be applicable to the rest of the families that they're working with. And also to provide emotional support. I think that's a key thing that we actually don't often talk about as coaches. But wraparound's hard. So for any of you who have been a care coordinator or been a supervisor of care coordinators, it's hard and it's exhausting, and you feel responsible for something that you're trying not to feel responsible for because you want a team to be able to take the lead. And care coordinators and supervisors actually need a lot of emotional support so that they can feel like they're competent and that they're growing, and when mistakes happen, it's okay because they're still learning. And I think that's a really important process in the coaching. Here we're just talking about the use of instruments that provide data to guide coaching. And data is so critical. And in the states that we're working in, including Maryland, we have been using the Wraparound Fidelity Assessment System, which I know is something that was discussed on the last webinar, so I'm not going to dig into that too deeply. But the instruments that have come out of that have been really helpful in the way we provide coaching, and I think that would be very helpful to other states as well. The community supports for wraparound implementation tool, the wraparound fidelity instrument, the team observation measure, and the document review measure. As well, in some of the states, they're doing caregiver and youth satisfaction surveys. And what this has done for us in our experience is it provides us with reports. So we're able to see at a state level, after gathering all this information through interviews or through team observations or document reviews, where are people doing really well and where are their strengths and where are their areas for improvement. We can actually target coaching and support and even training around those key areas. So using data continually through the whole process is actually pretty helpful. Data can be helpful because it provides standards of quality for wraparound implementation, encourages best practices for care coordination and family support, encourages families to be part of the solution, and it reinforces family voice. Because families, if you're doing the wraparound fidelity instrument or the satisfaction surveys, for example, family have the opportunity to say what's going well and what components of the process are actually happening and happening the way that they should be. So it's great to have families actually be a part of how coaching can then move forward. And it influences procedural changes within care management entities or within organizations that are implementing a wraparound practice model. This is another example of a tool that we've recently been using, and this comes out of the Portland State RTC and Wraparound Evaluation Research Team. It's the impact of training and technical assistance tool, the IOTA. And we're just now using this for us. I know it's been used in other areas in the country, in one of the states that we're in, and it's been pretty interesting to where we can actually assess where the baseline is. So folks are asked to complete a survey prior to the training, after the training, and then 2 months later. So we can see how they've experienced the training. Was it effective? Does it tie back to the practice that they're actually doing when they go back to their jobs, and are they able to incorporate it over time as it moves forward and there's some distance in between that initial training and the work that they're actually doing. Next slide. Oh, we're going to actually launch another poll here as well. Okay. So here we're going to shift. You know, this has kind of been an overarching view of what is training, what is coaching, why is it important, what has the research shown, what are some of the tools that you can use in implementing a model within your own community to really guide how coaching and training goes. And now we're going to shift into talking about our model. This is at Innovations Institute, and what we've kind of been set up to do and how it's grown over time. But we are an institution that certifies care coordinators, family support, so caregiver peer-to-peer support, youth peer-to-peer support, certification of supervisors and coaches, all within Wraparound. And we consider them all to be Wraparound practitioners. So when you hear Wraparound practitioners, we're actually talking about the full group of all of those different individuals. Next slide. I'll talk about the poll before that. So the poll was, how is training and coaching in Wraparound provided in your state, region, or organization? And we were interested in this question because it really does vary across the state. And everyone knows that it's a pretty important process, but yet not everyone has access to it. So the poll results were, it's not provided, 15%, contract with outside consultants or training groups, 36%, which was the majority, purchase materials and self-trained, 22%, previously used outside consultants or training groups, and that's 18%, and we do not currently have Wraparound in our area, and that was 9%. Okay. So steps in developing a model for coaching and certification. And the reason why we included this was because it was actually a process that was really helpful to us, and I think it could be something that's helpful to others if they have the time and ability to really walk through it. It's something that I think could be useful. So for us, we did have the opportunity to have regular consultation with national experts, which included Mary Jo Meyers, Pat Miles. We've also had contact for family support with Tony Isidore, Marlene Penn, and again with Eric Bruns and Janet Walker. And that consultation has really helped and guided us into a place to where we could develop a model that we feel like is pretty strong. We went through a process that was facilitated with those national experts, and we identified key elements that are unique to Wraparound. And what was also really helpful in this process is that it was really about our perspective within our organization, because we do talk a lot about how Wraparound has a lot of different perceptions about what is Wraparound, just like you answered before in the poll, that it actually varies across site to site. So for us as an organization, we wanted to make sure that when we're providing training and coaching, it's consistent to the model that we believe works when folks are out there doing the job. So we developed a matrix that outlined and defined those key elements, and then we tied to that skill sets, outcomes, and identified tools that would be helpful in that process. We went through this process and did repeated revisions and got feedback from consultants to get to a place to where we could develop a model that really pushed us into how we were going to develop training and coaching that we do both within Maryland and actually nationally at this point. Next slide. And this is just kind of an overview. That when we were talking about it, we really felt like there's an overarching ecological framework in Wraparound, which included those feelings, those actions that happen within teams and collaboration, that all of that is really embedded within a Wraparound process, which makes it unique. The key elements that we pulled out of high-quality practice in Wraparound included grounded in a strengths perspective. And again, you're not going to see the principles here that would say normally strength-based, because we wanted to push ourselves away from the typical jargon, because I think people get to a place to where they use the jargon and don't actually think about, well, what does that really mean and how is it operationalized? So we pushed ourselves not to use that, but I think you can see where it maps back to the principles here. That wraparound is determined by families, it's driven by underlying needs, and that there's an investment in accountability and results. And once we identified those key elements, we defined them and really said for us, what do they mean? And then we went across the 4 phases of wraparound and identified key activities that should occur in connection with each element. So for determined by families, in phase 1, what would that look like? What is a key activity that should happen in phase 1 when you're engaging families and you're prepping for your team? And then we went through and attached skill sets to that. So if we want to make sure that they're able to do this activity within this element, what skills do they need to be able to be successful in that? So after we were able to develop it, we mapped it back to training and coaching so that we could highlight these skills within the training to make sure that folks could leave training and have a better understanding of the skills that they need to have that are a little bit more developed because we practice it within the training, but that would be reinforced in coaching over time. And then we continue that process for each certification group.
So now we want to talk a little bit about how it actually feels and works for those frontline workers and the supervisors and the folks on the ground that are actually implementing wraparound. And so some of the tools that we use that Marlene touched on a little bit are the team observation measure, the document review measure, and we've also started with a wraparound practice improvement tool that we will discuss in depth on the next slide. So the Wraparound Practice Improvement Tool, which we affectionately call the WIPIT, which is kind of interesting, it was actually designed around support for supervisors and coaches in providing feedback to frontline workers. What we observed as we are out working in different states and different places is that workers were really good at picking up those fidelity components to walk through each individual step that kind of the details of wraparound practice. But we also saw some gaps in quality and how the staff implemented quality practice around associated with effective WRAP implementation. So this practice improvement tool focuses really on phase 2 and 3 of wraparound for the initial plan development and plan implementation, and how do they move into this quality practice that is associated with effective wraparound implementation. And it's checklists just for people to follow to be able to have something to go by and give feedback around to really push toward those innovative practices where everything is integrated and connected. This tool is still under development. I think that there's another webinar in September where we are going to discuss additional practice instruments and the data that we've collected around this and how it's working. So that will be to come. And on the next slide, I want to walk through specifically what it looks like for coaching and training for us as we're certifying staff either in the state of Maryland or in other places. And one of the components we found that is crucial is involving supervisors and frontline staff. So anytime that we're coaching, that we're in a jurisdiction or in an organization, it's really important to have all levels of support there because it really impacts how staff move toward high fidelity and quality wraparound practice. And we've broken it down by phases. So in phase 1 around team prep and engagement, really providing support around not only engagement of families but also team members, and I think that that's left out sometimes. And how is it that they generate this multiple perspective around the family story? How do they find out what's gone on, what have they tried in the past, where do they want to go, that kind of thing. And really developing a sense of the underlying need and where they need to focus in their time in working with these people, or with the families, working with the the wraparound teams that they're working with. And we do this by observing face-to-face meetings with the family, first visits, calls with potential team members, as Marlene talked about earlier, and really sitting down. How do you do that? How do you get that perspective from that team member and also begin to generate some sort of comprehensive story around everything that's going on, and also during supervision at this time. During phase 2, on the next slide, we again continue the support with face-to-face and meetings, but prepping prior to the child and family team meetings and prepping debriefing after. But how is it that we provide support for care coordinators as they're facilitating this team process for the first time? How do they, as Mary Jo talked about, develop a product? How does this plan come out of this team process, and how do we work with them around that? And again, making sure that supervisors are involved in this process so that we can transfer that skill, so that when we're gone, the supervisors can continue to support staff in quality implementation, which is really an important piece in the model that we try to adhere to, is really leaving folks with sustainability, where supervisors, directors, have the capacity to carry on when we're not sitting at the table. And so then we carry this same practice over into phase 3. Again, continually engaging families, and how do they monitor progress? How do they know that they're moving forward, that they're getting closer to the achievement of the family vision and the team mission, and how do we know that their needs are being met? And how do they track that? Because just because a service was put in place does not mean that a family's need was met. And continuing to develop a deeper understanding of the underlying reasons that things are going on and behaviors are happening, and then how is it that the strategies we're using to address the needs, how do they change according to the effectiveness or ineffectiveness of what's going on, and monitoring that progress. And again, we're involved in face-to-face meetings with the families, meetings in between CFTs, prepping prior to the child and family team meetings, and then again in supervision. And then in phase 4, on the next slide, recognizing that transition is something that happens throughout the process. I think that WRAP is an intensive process, and we really get involved with the families that we work with and the team members, but how do we let them know that the process will end, and ensuring that the family perspective of met need has been achieved. Did we make a difference? How did we track progress over our time together? And again, this occurs in multiple settings, always with supervisors present, so that that transfer of skill can continue throughout the coaching process. So as part of our certification, on the next slide, it breaks out a little bit of what the requirements are, like the actual physical things that the care coordinators would have to do. And it's a minimum of 1 year participating in coaching, completion of the core trainings and training units that are around knowledge, skills, and values of wraparound. They must demonstrate competency in all phases of wraparound, and completion of 3 passing team observations. The team observation measure that we talked about is part of the Wraparound Fidelity Assessment System. 1 is actually completed by us, and 2 by their supervisors. They also must complete 3 document review forms, also again passing, 1 by innovations and 2 by a supervisor. Annual recertification is required, which is a component of training and coaching, so that it's just that continual support so that they can maintain the level of quality that they've attained, and how do we ensure that there's not a deviation from the practice model. And again, all interaction, and I can't stress how important this is with direct supervisors of the staff, so that, again, that transfer of knowledge can happen. And the process generally takes about 18 to 24 months. We are in the process of testing a simulated testing model for the completion of certification, and you guys will have to stay tuned, and we'll give you an update to let you know how that goes. So on the next slide, we talk about the model for supervisors. So the supervisors have to go through the same core components as the care coordinators. Training, they have to participate in the supervision of the staff. There's some additional trainings that they are required to attend around directive supervision, utilizing the tools that we use, and how do they supervise around a quality practice. They again have to complete the TOMS, the team observation measure, and the document review forms for the teams that they're working with, and they have to be present at all coaching sessions. And then demonstrating a proficiency in utilizing the tools, as well as developing an in-depth understanding of quality wraparound practice and how to support their staff in the implementation of it. And again, final certification, we're toying with the idea of a simulated activity and how would we observe that as a final scenario for certification.
So the next two slides, we're talking about peer-to-peer support. And in Maryland, we're only doing the certification in Maryland currently. And we've had a recent shift. We are one of the 1915 waiver states. And as part of that, we were able to include peer-to-peer support as a Medicaid billable service for both youth and caregiver, which was actually very exciting. However, when it happened, it kind of shifted the model that we needed to use for training and coaching, and we're in a place right now where we're trying to figure out what's a better model to use to really support the peer-to-peer support partners in a way that sort of meets them where they are right now. We're trying to figure out how they can be involved in the level of training that we're asking them to be involved in when they can't bill for it. I want to make sure that there's a sustainable model for peer-to-peer support within Maryland. So I'm going to talk about this because this is what we've done up until this point, but I think I bring this up because I think a lot of other states are going to be in the same position, that as peer-to-peer support becomes a Medicaid billable support, things may need to shift in the way that we work in training and coaching with peer-to-peer support. So for caregiver peer-to-peer support, we've done a minimum of 1 year of coaching as the other ones. They're required to complete core training and core training units. So those are, it says SACTI here, which is our System of Care Training Institutes that we have in Maryland. And this is with all of the practitioners that we certify. We ask them to get a certain number of training units that we categorize according to knowledge, values, and skills. A completion of 3 caregiver peer support partner TOMS. This is in a revision process. We developed a tool that sort of paralleled the team observation measure that we use with care coordinators, and found that a lot of the work that family support partners do actually doesn't necessarily happen in the team process. It happens before and in the middle between team meetings and the ways that they work with families. So we're also in the process of developing a new tool that could be used to observe that engagement process that happens with families when they have the regular meetings and the time that they're spending with them and helping them to prep for child and family team meetings. And documentation reviews. So again, as we shifted to becoming a Medicaid billable service, there's certain documentation that's required in that. So we've been developing a tool that will actually help within coaching and within certification to guide them through what is the necessary documentation that they should be doing that's still written in a way that's strength-based and, about the family that's really positive. Next slide. Youth peer-to-peer support partner certification is very new. We have four or five youth right now in the state of Maryland, and it's continually growing. This one was also a bit challenging because we found that a lot of the young people who are interested in the positions, they have to be over 18 because of Medicaid, but they're not in a place to where they're interested in working full-time. And because of that, we really struggled with making sure that we were going to certify a group of practitioners knowing that they had the knowledge and the skills and the abilities that they would need to do their work, and at the same time not burning them out to where they're spending all their time in training and coaching and not having the opportunities to do the work with young people. So it's a little bit different than you would see in the requirements for the other practitioners. There's a minimum of 1 year of coaching again. Youth leadership retreats, we thought that we have a youth coordinator in Maryland who actually helped develop all of this. that the retreats were actually much more friendly than having them go to the trainings that were for broader audiences or more formal. System of Care 101, which was developed specifically for young people, and WRAP 101, which is the training that we use for WRAP 101 is general enough to where it can apply across all audiences. Skill building for youth support partners, and again, the training units in knowledge, skills, and values. Next slide.
So in this model for coaches and trainers, it's a train-the-trainer model, I suppose, if you will, all coaches and trainers must complete the core trainings and participate in the same activities as required by supervisors. And again, they must demonstrate an in-depth understanding of both high-fidelity practice and high-quality practice. And how is it that they can support organization staff and even partner agencies that are working on a team or working in a wraparound practice approach to improve and continually build upon the skills that are hopefully left while we're there, to sustain a state or to sustain a model in a place where they're not continually relying on outside entities to come in and train and support their staff and their organizations and in their states. And again, I can't emphasize enough that we really want to emphasize the transfer of skill and how is it that these states and organizations can sustain themselves without continually having to go outside to attain that knowledge, and really supporting them with tools and things that they can use as they move forward.
And so we're shifting at this point back to Mary Jo to talk about the local capacity for certification within WRAP Milwaukee.
Okay, and actually this is where we're doing a poll question to find out how many of you have been multitasking throughout our presentation. Just kidding, but wanted to make sure you're still with us. So in terms of developing local capacity, one of the things that's been very exciting in terms of being involved with innovations is to really look at having the luxury as an outsider looking in and assisting of what it could look like if you had a lot of resources to put something together like they've done. So it's been pretty exciting to see what they've come up with, but I also understand what it's like to be involved as a deputy director for Wraparound Milwaukee, of how to try to pull something off locally that you can still feel confident about. You can feel confident that people are getting what they need to actually implement a team-based model. So when we first started out 16 years ago with a grant, we had the luxury of bringing in multiple trainers and consultants, but you quickly learn that you want to begin to define what your local needs are, and that the grant is eventually going to go away. So what will you do then? So early on in the development, we took a look at what we were going to do locally to make sure we could sustain a team-based model. So what I'm going to share with you in the next 15 minutes or so is really just a highlight of what we have developed over the years and what we continue to do to try to assure that people are practicing the model in the way that we hope to be providing the right thing at the right time in the right way for kids and families. So what we've really done is similar to what Kim was saying about train-the-trainer model, utilizing both outside and local expertise. We have care coordinator supervisors and lead workers that we've actually, by design, created them into trainers and coaches. So while not everyone has the training skill set that's needed, your hope is that you can develop supervisors and what we call lead workers, which would be like assistant supervisors, into coaches. If you don't have the sense that a supervisor and or a lead worker can function as a coach, you're really going to have a difficult time trying to make sure that you are sticking to a model. And for us, it's wraparound. So we set up their job description, and we also write policy and procedure that helps support their role as coaches. So they're more than just supervisors and leads, they're expected to be coaches. What comes out of that generally is that a few people will also have some comfort level with upfront training, and you want to build those supervisors and lead workers into leadership roles as soon as possible and develop many opportunities for them to co-train with you, observe your training, learn how to use their skills in front of people, so that you have, what you're doing is really growing a cadre of trainers and coaches. And what we've been able to do quite successfully here is I actually have cadres of trainers and coaches that are actually now out training and coaching nationally as well. So you want them to have some local expertise, but trainers and coaches actually have to have the ability to take those skills and successfully respond to outside entities or outside communities that will have different needs and different structures. What we've done, because we don't always feel like we have the capacity through our 8 lead agencies, we have 8 lead agencies which potentially would have 8 supervisors and at least 16 total coaches and supervisors at the end. What we wanted to do, though, is also build a way for peer-to-peer support, so that they're not just responsible for the training and coaching at their own entity, they also are involved in activities in which they're coaching and training other entities. We've also developed positions that we've labeled as coaches and consultants who work outside of their agency and basically work for Wraparound Milwaukee as trainers and coaches, so that you can, especially when you're doing evaluation, when you're taking a look at people's skill set, that you can feel a little bit more confident, though, that they're objective, that they're able to look at people's skill set in an objective way because they're not just doing it for their own entity. Just in terms of basic tools, materials, and processes, while this is not an inclusive list, our training curriculum was written primarily by Pat Miles and John Franz. Then what we did, similar to what Marlene was talking about earlier, is we took that curriculum and our matrix, so to speak, and developed modules that were written by myself and other local experts around those pieces that are unique to Wraparound Milwaukee, and then those pieces that are unique to Wraparound process and philosophy. Right now we have 10 required modules which must be completed within the first 6 months of employment. If they aren't completed within those 6 months, then that person cannot continue to receive families. And this is followed by monthly training days that are also required. And then they get ongoing coaching and supervision from their supervisors and lead workers. We have additional support put in place by Wraparound Milwaukee consultants. Those people are also trained as coaches and have the ability to train. There's a recertification refresher training that must be completed every year. That's a minimum of 2-day training. What I've learned to do, which has been very successful, is actually put the supervisors and lead workers in charge of that curriculum. I do oversight on it, I approve the curriculum, but they design it and they also implement it, which has really helped them in terms of their skill set. Any of you in the audience that are trainers and coaches yourself, you know that part of your experience in training and coaching is that your skill set develops. So you actually become stronger in what you do by virtue of being a trainer and or coach. So that has always been in the back of my mind as I've continued to grow local trainers and coaches. We do what's called a facilitator review. It's one of our tools to see how the team is functioning. That's done on a facilitator quarterly. We also have agency performance indicators that are done twice a year. These measure a variety of things, but one of the things it measures is how their teams change over time, their use of natural and informal supports, how they use strengths in their plan, what kinds of community resources are being put in place. So where I'm going with that is we actually had to develop a model in which I've talked about operationalizing the value base, and Marlene made reference to that. You need to find a way in which people can get feedback as to whether they're actually doing what they say they're doing as it relates to the values and principles of Wraparound. So the feedback they receive through our management information system actually gives them some measurement on how teams change over time, how they're functioning within their child and family team. And then, as I said earlier, there's a monthly coaching meeting that's held with all supervisors and leads, and every month we have a topic of the month that we may pick to work on to develop their skills as supervisors and coaches. And then the care coordinators themselves, or the facilitator of the team meetings, are also meeting monthly with a topic of the month to help them improve their skill set. The next slide gives you just the titles of the training modules. The reason I'm sharing that with you is not because it's going to be what everyone would pick as part of their recertification or their certification, but it does tell you what, for Wraparound Milwaukee, these have been the key modules. Some of them are a half day, some of them are a full day. Wraparound Philosophy and Process, which families help us train on, is actually a 2-day module. But it's just to give you a sense of those key things that all facilitators have to have within the first 6 months of their employment. And they have to complete these. It's approximately 64 hours total. Next slide talks to you about some of the tracking tools that we use. I made mention of the facilitator review. We also have a plan of care audit tool to take a look at the plans or the product that comes from the process. We recently introduced what's called the SWIFT tool, which is a review tool that the teams actually complete after every team meeting to say how the team is functioning. Not so much a measure of the facilitator as much as it is a measure of the team functioning, how they're doing as a team to help the family. We also have reports from our management information system that track things such as the team makeup and how that makeup changes, as well as the team meeting time and location. Again, trying to adhere to the principles of family-centered, we want to know where are the meetings happening, what time of day are they happening. So we've developed mechanisms in which people can get as much feedback as possible to improve their performance. I mentioned earlier the agency performance grids. They don't have to wait twice a year. While we give them and meet with them and go over them twice a year, 2 times a year they have to give us feedback on their plan for improvement of their skills. But having said that, they actually have access to that information at any time at a touch of a button. So they can look at that monthly if they choose to, but we actually go over it with them as an entity twice a year and then do a performance improvement plan. Our family organization called Families United also does phone surveys, which we've put together with their help on how teams are doing. And then lastly, family and youth satisfaction surveys. Family and youth satisfaction surveys at this time are being done through the mail. Just some helpful hints in terms of if you are developing something locally. The things that have worked really well for us is having families as partners in training as well as participants. So we have actually had families who have become trainers and coaches as well, and they always help us with every training that we do for Wraparound Milwaukee. We also have created opportunities for our facilitators to become trainers and coaches. So if they're not in a lead worker position or supervisory position, we've created avenues for them to still work into a role, and we've actually carved out roles for them through their contracts for them to become coaches. Also, setting expectations pretty early on for supervisors and leads to train system partners and providers. One of the things that have helped their skills tremendously is that they are trainers for our provider training. Or when we do cross-system training with child welfare and probation, it's our supervisors and leads that are helping me with that both up front and at the tables. You also want to make sure that you've created meaningful feedback tools. You want to make sure that this philosophy that we call wraparound, one of the earlier polls that we did that demonstrated that one of your biggest challenges, close to 50%, was that you felt you were trying to implement in an area that there are many definitions as to what wraparound actually is, And as Marlene pointed out, as we train nationally, that is one of our biggest challenges, is first going in and finding out how is this community even defining wraparound. So one of the things we found helpful was to make sure that not just our vision and mission statement for Wraparound Milwaukee, but all of our policies and procedures, walk the walk, talk the walk, our audits actually follow the principles and philosophy, that we're not just doing audits that have to do with compliance, but we're actually doing audits that help to measure quality of implementation. So just looking at your policies, procedures, your training, have you truly embedded the philosophy and principles to make them a working document and not just words on a piece of paper? Having said that, I often do a training now on changing agency culture. One of the things we learned early on is that you'd have people trained as facilitators, but they would work in an agency that really didn't support them running teams. And so we really had to take a close look at how do you change agency culture around being strengths-based, needs-driven, and having a team orientation. How does that agency culture promote teamwork? And how do you help normalize the process so that wraparound isn't a program, but actually a process that the whole agency is embracing? And then also ensuring that your outside consultants providing training and assist you in developing a sustainability plan. So really looking at whether you don't want to, as I believe Kim mentioned, you don't want to create a situation where you're dependent on outside consultants. You want to look at possibilities. What is your sustainability plan? What will your certification plan look like? It could include, like I spoke about earlier, the early identification, development of local trainers and coaches, figuring out what kind of manuals you need for trainers to be trainers, and ongoing consultation when needed to help you with that, and also looking at booster trainings when needed. So that's the conclusion of our actual presentation. I'm going to turn it over to Janet to see how we're going to handle questions.
Okay, well, just wanted to make a couple concluding comments. First, thanks to our presenters. Again, this is great information for people who are listening. This is a distillation of a lot of experience and very worthwhile information. The resources and websites, I do want to point out that the National Wraparound Initiative is in the process of building and will be launching next month a new website. I put that into the chat box because unfortunately at this very moment that link from rapinfo.org. We're going to update it soon. I'll have to get somebody to do that, but doesn't go to the new website. Regardless, you can get to the resource guide to wraparound from the old website or the new website from a similar way that I described in the little chat box there. In Chapter 5, which is all about supporting wraparound implementation, there are 6 chapters about training. And a variety of other chapters within that section that may also be of interest to you. There's a tip sheet, for example, created by Pat Miles on how to choose a trainer or consultant and some things to pay attention to help you make a good decision that's going to help your project. So just wanted to mention that. The other links from rapinfo.org or from the NWI new website you can access directly. So we had a couple questions. I don't see, let's see what we're doing with any hand raising right now, but let's start with the questions that were typed in here. So the first question I got here from Rusty Miller: who provides the separate coaches of supervisor, trainer, and coach? Does anybody want to take that one on?
Can you repeat that, Janet?
Who provides the separate roles of supervisor, trainer, and coach? I think that means so over time as your project matures, I guess. Is it the same person doing those things or not? I think we had some discussion of that, but perhaps if somebody wanted to pick up with that a little.
Well, we actually presented 2 different models. I mean, for innovations, it would be their organization who is doing the coaching and training for supervisors and others that you're training is a train-the-trainer model so that they can become coaches themselves. For Wraparound Milwaukee, what we've done locally is we've actually embedded it into their job description so that all supervisors and lead workers are expected to be coaches. Some of them evolve to trainers, and we create those opportunities.
Marlene or Kim, would you like to comment on that one?
No, I think Mary Jo covered it.
Okay, I have to apologize to people. I accidentally just unraised everybody's hand. I was trying to sort by hand raising and I accidentally clicked the wrong button. So if you did have your hand raised, can you do that over again if you have a question that you want to say verbally? In the meantime, I'm going to go back to the list of written questions. There was a question about, are there specific trainings for wraparound supervisors on coaching and other skills? And there's a second part here that I can deal with right away. I know there's a training in California in June, and that's actually Eric and I are going to be doing that one, and it's going to be a pretty basic, more informational stuff about wraparound implementation. I think it's more at an introductory level. So can one or more of our other panelists respond to the idea about specific trainings there might be for supervisors on how to do coaching and other related skills?
Well, I'm not sure if there's national trainings that are going on that are just open, you know, to broader audiences. For us in the communities that we work in, we do provide training separately for supervisors and coaches, and there are specific skill sets attached to that, if that's answering the question.
Mm-hmm. And that would be the same for myself. I mean, often that's what people bring us in just to do.
Yeah. Right. My impression is that generally the national type things that you find at conferences are there isn't, it's not really enough time or enough detail to get into a specific topic like that, so that would be something that you would arrange specifically, either locally or with a national person to come in and work with you around that. Okay, so this question, another one, how much does Innovations charge for the certification initial and ongoing? I don't know if we can get an exact amount, but maybe some just general information about what to expect in terms of cost if you're bringing in somebody from the outside to do this.
Yeah, I mean, I think it depends. When we developed this model, we really developed it to be as inexpensive as possible. So we did it, we're a nonprofit, we're through the university, so we really did it at bare bones that covers expenses and covers personnel. I can't really give you an exact answer because it really depends. In each of the communities that we're in, they've asked for different models, and each model is a different cost. For some of them who wanted to train up family support partners or coaches that were specifically for family support, that's a whole additional human who goes out and does that, and additional costs associated with it. So I can't give an exact answer, but I can say that because of who we are and where we are located within the university, we do try and keep it as inexpensive as possible.
And again, the National Wraparound Initiative does, at this point, have a list of consultants on the website. It's somewhat outdated. As part of our shift to our new website, we're trying to get that completely updated. We don't at this point have the ability to specifically recommend people. That's why we provided this tip sheet on how to choose a consultant. But we do provide contact information and some background on various people who have listed themselves on our website. So, if you want to get a quote or whatever, you contact people directly. So the next question here that I have, I can answer pretty easily. Where can we get a copy of the... Oh, I'm sorry. I can't answer this one. This is not the question I thought. But where can we get a copy of your family and youth surveys? I heard several family and youth surveys get mentioned, so anybody want to take that on, the satisfaction surveys, other things?
I'm sorry to have to ask this, Janet, but is my direct email address connected with this presentation?
Yes, I see it right here on presenter contact information. Right.
So anyone who would like to email me, I'd be more than happy to send things out.
Same here.
Okay, so that was easy. So I think we're getting down here. There's a long question. Does private insurance, what is the extent to which private insurance sources are supporting aspects of the wraparound process? Can we get some maybe...
Janet, it says here that that's for a future call.
But does anybody want to comment real quickly on whether they see that happening at all in their site?
Can you repeat that, Janet?
whether private insurance is helping to support or providing wraparound that you know of.
A small amount, not a lot though. I don't do a lot.
Yeah, well, I mean, perhaps with the rapid evolution of the healthcare system, that we might have more to say about this in September. So we'll keep that in mind as a future topic. Are there specific trainings available for a facilitator of the wraparound meeting, specifically not just care coordinators? Well, this is interesting. So I suppose what we're getting at here, and I have definitely seen this as a model where there are people who facilitate the team meetings who are not connected with the team in other ways. That's my interpretation of this question. Does anybody want to comment about that?
Yeah, I mean, we actually had a whole program in which the whole idea was to teach the women who are adult women who are identified as facilitators. The population happened to be women coming out of corrections. I know there's other places I've been where they're training people as facilitators only versus care coordinators. So it really depends on the design of the program.
And I was once able to observe and have had a lot of contact in the meantime with a program in California. I don't know if they're still using this model, but they used it for many years, where they had a facilitator who was an absolutely first-rate facilitator, came in and facilitated a lot of their team meetings and then trained some of their people very much in kind of generic process of facilitation. Like, he knew what the wraparound process was, but his approach was a real focus on facilitation. And I seem to be getting an echo. Anyway, he was an excellent facilitator, and the model seemed to work very well. There's times, I think, when there's a benefit to the people who have sort of content to add to the meeting to be able to focus on that content, and someone else to be able to focus on moving the meeting forward, someone without an agenda or other things to remember or be concerned with during the meeting. How do we get the slides? Well, that's a very good question. On the National Wraparound Initiative website, we have posted already the last webinar, and we will continue. We post both the slides alone, as well as you can access a complete recording of the webinar, which you can play on a media player on your computer. I'm going to be looking into posting the results of the little surveys that we've been putting up too, because I actually think they're very interesting. So we're going to look into exactly how to do that too. So that is the last question I have on the list. I don't see anybody with a hand raised at this point. This is your last call for questions. Otherwise, I'm going to thank our panelists and ask them if they have any concluding farewells or last words of wisdom that they want to leave us with as we close the webinar.
I just
Anything?
Wanted to say thank you. It's been a pleasure being part of this, and I continue to be excited. I mean, I've been doing this for 16 years and can't imagine doing anything else. So I hope that you share my enthusiasm, and I hope you go out there and do great work.
Yeah, and same here. And please, to anyone who has any further questions or anything of us at Innovations, please feel free to email Kim or myself, and we'll get back to you as soon as we can.
Okay, well, I think that means we're going off the air now, and I'm watching the countdown timer. We're at 1 hour, 29 minutes and 48 seconds, so we did a great job. Thanks again to everybody who tuned in. We are going to be having our next wraparound webinar will be in May. I don't want to be pinned down on the date, but I think it's something like the 15th, and it's going to focus on other aspects of wraparound implementation. And we will be having another very prominent wraparound expert from Wraparound Milwaukee, Bruce Camrant, who's going to be presenting in addition to another expert from Innovations, Michelle Zabel, and we look forward to the next opportunity to share with you all. So that's it from our end. Bye-bye.